Sitting next to him is Mark Halliday. Okay. Mark is the head of the IFC's healthcare PPP consultancy practice. As everybody knows, IFC is a proud member of the World Bank Group. They are also the largest investor in emerging markets healthcare. So these are really, it's big money. Mark has an experience, used to be head of healthcare PPPs at Philips in the private sector. He's been in public sector back in the UK. He's now back in the international public service, advising governments around the world on what works. So, Mark, it's great to have you here, and let's get into the questions.
Thanks very much.
I mean, first of all, everybody understands with the World Bank Group, they don't hear all that much about the IFC, although they really should. I mean, if you're in the field in all these emerging countries, you know what the IFC is, but here in the United States, maybe not so. Tell us a little bit more about your work on PPPs and specifically your role that you play, and who is your client?
Okay, right. Good morning, everybody. The IFC is the private sector arm of the World Bank Group. Our role is to go beyond traditional development assistance into mobilizing the private sector. So we sit sort of halfway between public sector and private industry with a view to bring them in across the whole infrastructure piece. And as Trevor said, my particular niche is healthcare. To give you an understanding of roughly what we do, we became involved in healthcare IFC was set up in 1955. We became involved in healthcare in a serious way in the late 1980s. Since then, we have done about 350 transactions in emerging countries. And as Trevor said, we are really the number one in terms of delivering healthcare in low, middle income and emerging countries. I was just looking back this morning over what we've done. Broadly speaking, over that period, 30% of what we've done is big tertiary hospitals. The next two sectors, about 20% of it is diagnosis, imaging equipment, those sort of things. Another 20% is dialysis. Sorry, closer to the mic. Is that better? Yeah. Another 20% is dialysis, and then about 6% is health insurance schemes, and then the remaining bit is sort of a mixture of clinics and stuff. So we are very much in the forefront. Typically, our clients are national governments. If you imagine the way the World Bank as a group works, the bank will typically focus on high-level strategy. What are the problems in the country that need solved? And once a problem becomes a specific, that's when the IFC becomes involved. We're more of a nuts and bolts organization. We're the people who actually do things on the ground with people. A classic example, and one that figures in our, is the Queen Mamahoto Memorial Hospital in Lesotho. I don't know if any of you have been there. If you ever get a chance to go there, you really should. It is a world-class hospital, as good as anything I've seen anywhere in Western Europe. I think Lesotho is number 167 in terms of development in the world, and has had a tremendous impact on that country. Before the hospital opened, if you had an underweight baby, it was going to die. The neonatal survival rate has now gone from 0% to 87% just by opening a single facility. And in real terms, what that means is there are 3,000, I think it's 3,020 when I last looked at the figures, people who are alive today that otherwise would be dead. Over the lifetime of the hospital, that's probably going to be something like 10,000 people. And it's not a matter of budget or anything, because one of my colleagues was in another government hospital a couple of months back, and an underweight baby was delivered there while we were visiting. And there was a $50,000 neonatal incubator in the room, but the baby was taken to another room effectively to die, simply because the management of the hospital didn't have the wherewithal to make sure the machine was working. The staff didn't have the training. So, we get criticised a lot. I mean, almost every month, some critical report calling us all sorts of things comes in my desk. But we're really proud of what we do, and we have achieved real, tangible results that are making lives better. And people are alive today who otherwise would be dead.
Thank you. Going back to the top of the stanza, yeah. I've drawn some pretty provocative connections between health infrastructure, PPPs, and economic growth. Yeah. That would fill a gap that some donors may be leaving or reprogramming for. Yeah. Do you disagree or agree?
In part.
Yeah.
And if I could expand on that, to give you a couple of examples. I was talking with the government minister in country X, where we are advising them on some healthcare matters. And he was relating a story to me whereby a big multinational company was going to come and have a major training facility established in their country. And they came and did the due diligence. Everything was perfect, had all the right facilities, except there wasn't a satisfactory hospital available in the country. And that business simply went somewhere else, purely on the fact that the healthcare was considered inadequate. I am going to disagree with you about UK PFIs. They have had a very bad press. But if you actually, again, go into the hospital, these were construction projects. As an aside, when do PPPs work best is when the private sector can bring something that the public sector can't do. And in the UK, the problem was construction management. Back in when we were working in the mid-1990s, most hospitals in the UK were 100 years old. The Victorians had put up some really cutting-edge stuff in 1880. In 1980, it was done. And for all of the great training in the medical schools, one of the skills they don't train doctors on is construction management. And even if you're a professional hospital manager, a hospital gets rebuilt maybe once in a generation or once in 4 or 5 generations. If you're really lucky, you'll do one project in your lifetime. And so bringing in a construction company that does construction all day, every day, means you're leveraging that skill. So the hospitals are really good. I mean, I love the National Health Service. But when I go, my experience of it, building great, and my doctor has beautiful penmanship. But he writes out his records of our meeting, longhand, on a piece of paper. This is 2020 nearly, and they're using paper. The UK NHS spends £1 million, $1.5 million a year, just dealing with lots of bits of paper that have been sent to the wrong address. It's insanely inefficient. Now, in fairness, the opposite end of the scale, if you try and do something like National Programme for IT, that's not really the solution. There is a balance, if I can say. Partnership is the real message, and trying to do sensible solutions at a sensible scale. Sorry.
This is perfect. Yeah. I mean, you've had, I mean, if you look at Mark's bio, he's literally been Mr. PPP since practically the day he was born. It's like Pelé and the soccer ball or something like this, you know? So, you know, you've had reason to reflect on the major lessons you want everyone to hear. I'll be a little bit more specific in my question in a second here, but just, you know, macro yeah. picture of the major lessons you've learned from private and public sector here.
Okay. Yeah. Lesson number 1, it is not free money. There is a cost to it. And the essential trade-off in a public-private partnership is the value you achieve is greater than that excess cost. And that comes from getting the right person to do it. So in the UK, it's getting good construction in, so you don't waste money on construction. And if you want to know what construction waste is like, Scottish Parliament building is a classic of it. Budget £40 million sterling, outturn construction cost £450 million sterling. that's what you're trying to say. It's interesting where PPPs are now about 20 years old. So we're in the stage that we've gone beyond theory and we're now starting to see the lifetime outturn actual cash results. I was talking to the Portuguese government, and their first 10-year healthcare programs are, in comparison with doing them as public hospitals, doing them privately are generating, after financing, savings of between 15 and 24% over the cost of delivering public hospitals. So a well-structured PPP can be really effective. The other thing I would like to say is that healthcare done badly can be really value destructive. And the best example I can give of that is in a Western context. If you look at here in the United States, let's look right close at home, there is a completely self-inflicted opioid crisis in this country. That is healthcare done badly. The cost of it, according to the White House's figures, is $500 billion a year. And that goes right into the economy at all levels. It affects local authority budgets in a whole range of public services have to deal with it. If you just, to put that in context, $500 billion, going back to what Tim, my colleague, said yesterday, would basically sort out the whole sustainable development goal in one go. So healthcare is not just about doing things well. It's also about not doing things badly.
Mark, you talked about specificity, and so I'm going to be a lot more specific. You've got big money in the room on the government side. You've got big money on the private sector side in the room. You've got folks listening to you through webcam and all the whole rest. And this is going to be on the record in perpetuity. In any case, so what is your specific advice to governments? I mean, what would you want the governments to hear really, really specifically? Where the mistakes being made, and equally so on the private sector side. What is your very, very specific advice? And he's like an engineer, really targeted. So, Mark.
Advising governments, I'd first of all say be an intelligent customer. Sorry. Yeah. Okay. I'll just rip it out here. Be an intelligent customer, and by that I mean it's all very well doing a single project, but any project should fit in a strategy. So have a strategy, budget appropriately. Again, it's not free money. These projects aren't going to be done without the right upfront investment, and do programs, not projects. If I can take one of my colleagues at the IFC's programs, it's what's called Scaling Solar. That is a regional program to deliver solar power plants. And it's been tremendously successful in cutting the price of generated electricity across Africa. If we could do that in a healthcare field, it would have a fundamental effect on the way healthcare is delivered and outcomes. If I have one big criticism, it's people think on a national level, but healthcare is a human issue. It cuts right across the globe. So why do we try and do everything differently in every different country across the world? The more you can standardize in a positive way, the cheaper it becomes and the more benefit. I'm sure from your point of view, trying to manufacture a different machine for 189 different countries in the world is just horrendously cost inefficient. Similarly, having 189 different project agreements when the UK's done, I think, 650 PPP project agreements. The Turkish government has done 30 project agreements. How to do a project agreement, how to negotiate a PPP. It's been done. It's been done really well. Don't try and reinvent the wheel and do it your own way, because time costs money and doing it your own way costs time.
Perfect. And then the final question I have for you, Mark, I mean, you travel around the world, and let's remind ourselves that Mark's clients are governments. I am not Mark's client. We can't be Mark's client in the private sector. So let's make sure everybody understands buy-sell sides of the transaction, right? If I were to be considered a client, it would be an immediate conflict of interest, right? So he travels around the world. He travels to exotic islands. He travels to multiple emerging countries, all of whom have greater aspirations than the present day. Mark, what are you hearing from governments? What are the themes again and again that you're hearing from governments that perhaps we don't that frequently hear here in the United States?
I think the most common thing is that there's a genuine desire on the part of governments to improve healthcare. I would agree with you. You know, it is about considering it as part of the national infrastructure. If you think from a government's point of view, you know, a few people in the population might go to prison, a few more will deal with the police. Every single member of a country's population will at some stage go to a healthcare facility. So they are incredibly important. I think they obviously want to do it in an efficient manner, and there's often quite a drive to do it quickly. You know, there's a perceived need to act quickly, and in that way, it's incumbent on all of us to bring efficiency to the process.
Perfect. So as we mentioned, we're going to open it up, ladies and gentlemen. You know, we put some pretty strong thoughts on the table, and you know, we welcome, you know, either of us, but primarily Mark, I think. He's our guest of honor. Any specific points you have? Yes, please. Mm-hmm. Could you introduce yourselves as you step up? Yeah. Thank you.
My name is Li Yang. Thanks for your presentation. Previously, I had also attended several World Bank meetings or IMF or some coordinated with the UN. And I appreciate you are talking about PPP especially. And the concept of PPP is very much sort of abused or misused. And I would like to give you an example. That's where I come from, is Rockwell City in Maryland. They have a town squares project. That's basically, simply say that it's PPP, Public-Private Partnership project, and by the Public-Private Partnership, some kind of little team. That's basically a developers team. And what they are doing is bring in a developer, use a developer private land to build a private town square. Eventually, 100% is to the developers. But in the meantime, all the project, every step of the way, from the design, consulting, and supervising the inspection of all the project is paid the taxpayers' money. And then if they design, they change a corner, and they say they don't need the corner, they want the government to buy it. But if there's need another piece of land, then the government can give it free. And then this type of things will go to another project. So if government want to give out the land to another developer, the government say they don't need a piece of land. Yep. But the developer, they use it to build something else, like swimming pool and everything.
Yeah, thank you very much. So, and thank you for bringing in the non-health perspective on PPPs.
But just very important.
What is the main lesson?
The main lesson is we have to have a government to be independent, to evaluate it project by their merits, not by who can bring in the money. Who can bring in the money? You don't know whether the money is steal or robbed from other taxpayers. And then it cause all the social problems, including the democracy, elections, and homeless, powerless. And they were forced, just some of the problem abuse within the project is to the seat, all system-wide. They affect homeless and poverty. They have unjust eviction of homeowners, and so they take away all people's money to their own.
Did I say
adventure.
citizens really cared about PPPs? And did I say that they really cared about healthcare and delivery of social services?
That's what I said. This type of
You're
things
absolutely right, ma'am.
in the health project, in the health, they use a health professional, physicians, EM,
Right.
or psychologists. They go to murder people.
Okay,
And then they
thank
take
you.
their assets, and including pension.
Thank you very much, ma'am. Thank you. Thank you.
So
very,
please
very much.
be
I mean,
very careful.
This
Thank
is
you.
real life. Everybody understands this is real life, and then there might not be actual lives hanging on it, and you see all the complexity in such a project, and the things that you're doing every day, Mark, they're real lives. You mentioned over 3,000 lives in Lesotho alone were attributable to some of the things that you did. Would you like to comment, or?
Yes, I mean, first of all, PPP is a procurement method. It is a way of primary. Sorry. PPP is a procurement method. If it's done well, it's a way of transferring risk to the right party. It will not protect you from stupidity. If you let a bad contract, it's a bad contract. Done well, they do really well.
Yeah.
And historically, much better than traditional procurement in outcomes.
Common sense is in low.
But
low.
you've got to be sensible.
Penetration here in D.C. So it's actually you can tell he's a Scot, very practical guy. Well, ma'am, please.
Hi, thanks for these interesting remarks. Amy Lin from USAID. I was intrigued by the portfolio mix that you laid out, Mark, in terms of IFC's health investments. And I was curious, as we've been talking about transitions for countries looking at declining traditional donor assistance in health, if you anticipate that portfolio mix shifting. Do you see any future investable opportunities in more service delivery? Do you see more roles for insurance scheme investments? How do you think that these transitions will affect IFC's work and its priorities?
Yes, I do see that. That's the historical mix. And again, there is a transaction cost to doing a project. It sits best in a large-scale transaction. And you're right. To address the healthcare needs going forward, you probably need more service, more primary healthcare. And on the face of them, they are not really at a scale and size to be done in this way. So that's why you have to have more programmatic approach. And very much what we were talking about internally at the IFC is more programs and less single projects. And in going back to the discussion we have with governments, is to ask them to think more on a strategic level. What are the long-term healthcare needs? If I circle back to Trevor's point about non-communicable diseases, 76% of the deaths in the world are non-communicable diseases, but it gets 1% of the development assistance. If we're going to radically improve healthcare, that can't continue. There has to be a different approach. Equally well, if you look outside the rarefied world of healthcare, in the developing world, 60% of healthcare expenditure is private out of pocket. That money is going to go to where those spenders feel it is most valued. There are big information companies that are doing healthcare in a radically different way coming. And I used to teach a course in a university in the Netherlands when I was at Philips, and 4 or 5 years ago, I'd talk about how I thought 2025 the biggest healthcare company would come from China. Actually, I don't believe that's true anymore. I think in 2025 the biggest healthcare company will either be Amazon, Google, or Facebook. And the most important medical device in the world, sorry about this, Trevor, will be the mobile phone.
Could be.
And so we're all going to have to really think and really change the way we go about our business. Because what we do now, what I did 10 years ago in the UK or 5 years ago at Philips, isn't going to be the way that healthcare is going to be done in 2025.
I'm sure Jennifer Esposito from Intel is very happy about that comment. All right. Rachel, I guess you're going to tell me when I think we were running about 5 minutes late when we should stop. But, ma'am, please. Yes.
So, Lee Verbois, Food and Drug Administration. So today we've heard a lot that you're looking for turning health into a credit, and health can be a credit and not a debit when consumers and governments have confidence in the quality of products. At the local level, to ensure this, we must also ensure strong regulatory underpinnings. Yesterday and today, we've heard a great deal about point of care, but not about the upstream needs to ensure qualities of systems. To ensure qualities of products following transitions, I'd like to emphasize the needs between the linkages of regulatory strength and regulatory systems to ensure the strengths and confidence in those systems and consumer protections.
Could not possibly agree with you more. FDA is also our regulator. But even if I was a private citizen, I would say absolutely correct. I founded an organization called USA Healthcare Alliance. A colleague of mine, Justin Custer, and myself, and we have a great board. Jennifer's on the board, amongst other people that are in the room. And specifically point out the strength of regulatory systems as an American competitive advantage. And it's because the FDA is the gold standard when it comes to regulatory policies. And I've spoken to Lou Valdez, who I think was very active with us on the PPP, in our PPP forum before, and she has written a lot about regulatory capacity and the need for regulatory capacity in healthcare systems, particularly in Africa, but not only in Africa. Let me give medical devices as one example. There's virtually 3 governments in sub-Saharan Africa that have a regulatory regime that approximates anything that FDA would be able to recognize as a medical device specific regulatory regime. Everything else is pharma specific. Even big countries like Ethiopia, we cannot practically even sell stents, which is the standard of care. We're the largest producer of stents in the world, into the country of Ethiopia because the regulatory process is entirely inappropriate to medical devices. That's the case in India. That's the case in multiple other cases in the world. So we need FDA in the game on the regulatory capacity piece as much as sort of their traditional role. And we're very happy to see FDA's global role be expanded. And we'd like them to be more active on medical devices overseas as well. We understand pharmaceuticals are perhaps the top priority, but we completely agree with you. And how can we work more closely with you? And that's perhaps exactly the genesis of why Lou joined our group as one of the founding members, as I did at the very outset when we started this activity 4 or 5 years ago. I don't know, Mark, if you had any...
Yes, no, I do. I think good regulation is part of being an intelligent customer. You do need it. Nobody should be afraid of it. Good regulation is also transparent so that people coming into a market can feel that they have got an equal shot at the game as any local business. Yeah.
Perfect. It sounds like we're at our logical conclusion, unless there's... Oh, was that you, Johanna?
I think I
Oh. Do we have one more?
Yeah.
Time? 1, 2, and are we going to call it a day at that stage?
Yeah.
Okay.
Okay, so thank you very much. I guess I had a question about healthcare versus health and investments that you would make in health, and particularly around infrastructure, because health infrastructure investments can be things like sidewalks, and in fact must be, and urban design has a massive health component that has, particularly as we're talking about non-communicable diseases. So I guess I'd be interested in just hearing if that's something that you're starting to measure and think about in the investments that you're sort of making and leading on. Thanks.
So we're happy to make public the presentation that my board, the USA Healthcare Alliance, made this week to the World Bank Group on healthcare as infrastructure. Happy to send it to anybody. You've got my email address. I can't hide. What I would say is you're absolutely right. I mean, if people can't find their ways to clinics, as small or big as they are, they can't find their way to care, their patient care pathways are disrupted heavily. And that could be a solar, that could be a Caterpillar power unit that's sitting in the back of the clinic to make sure that in the middle of surgery, that the surgeon's drill doesn't stop. Yeah,
sorry, Trevor, can I just make a point that I'm actually talking about people having places to move and walk and live safely. So not just about getting to healthcare, but getting around, active transport and things like that.
Yeah. Well,
so the broader physical activity.
So it's obviously key to prevention. We obviously agree with you in all respects. I have my Nokia watch. I'm fastidiously looking at 10,000 steps a day. I couldn't agree with you more, and I think Medtronic agrees with you. And I suspect anybody that's been around the NCD stuff, like you and I have been, Johanna, for ages, probably completely agrees with you. When you come to Medtronic, you're generally well beyond prevention. So we don't really have a big conflict of interest in terms of saying prevention is a great thing. How can we do more? How can we help you guys do more? 100%. We only make 168,000 medical devices at present in 93 manufacturing facilities, but really you don't want to come to us ultimately. So Mark.
I tend to use incorrectly, being a layman, medicine. Doctors do stuff to people, and healthcare, which is about the whole infrastructure piece, social fabric, good diet, all of those things are part of wellness. So I agree.
And then, oh, hi, Jenny.
Hey, Jenny Healy, HHS Office of Global Affairs. Building on what Johanna said, actually, we couldn't agree more that public-private partnerships are a perfect opportunity for sort of these taking around the world on helping sort of reclaim urban, green space and creating safe spaces for folks to increase physical activity. And the Deputy Secretary of HHS was on the high-level commission with WHO on the NCDs, and that was one of the things we pushed in the report, was specifically, in the U.S., we've got really great stories to tell in our cities around the U.S. of ways, whether it's from New York City to down in Texas, that mayors are going and trying to figure out how to reclaim urban space to create safe space for physical activity. And so we pushed in the report to have the commission maybe work on convening folks to sort of exchange best practices on public-private partnerships. So I would love to sort of echo what Johanna asked. Is that something that you are working on in your, Mark, in your work right now? Does that include, are you working on PPPs for the physical activity? And then more broadly, for HHS and our multilateral engagements, we're trying to take every opportunity to re-infuse this conversation of the need for public-private partnerships, not only just to reach the SDG goals, but that's the only way that you're going to increase health workforce capacity. At the WHA delegation this year, the U.S.'s non-governmental advisor, we had a lot of amazing options to choose from, because I think there's so many great U.S. companies that are engaged in public-private partnerships, but we brought Varian Medical with us because they're doing some great workforce public-private partnership initiatives in Africa, specifically around training local workforce to maintain and work on their equipment. But it seems like we've got some great opportunities later this year, both of the high-level meetings around UNGA and NCDs and TB, and we're still looking for ways to sort of ensure that this conversation is included in those discussions as well. It's sort of, I feel like it's one of these things that everyone talks about in rooms like this, and sometimes with the door closed, member states are like, oh yeah, we totally agree, public-private partnerships are key. But in the public, when you're, sort of talking about what do we do next in outcome documents, it's really hard to get, for the U.S. to get people to agree to include language on this. And so we're all ears for ideas on how to make this conversation be something that people are comfortable in the public space too, in the public discussions, especially in the multilateral organizations, and more examples and more connections with people that are doing this as their daily job would be awesome. So.
I heard Mark in there.
The direct answer to your question is no, I don't do it. We have a team. I have a team colleague, I am part of a team of colleagues who do a whole range of infrastructure pieces. There is a scale at which it becomes inefficient. The PPP is not a solution for everything. There are a range of projects and programs that it does and fits in very well. And there are some things that traditional procurement approaches are better for. And also local, rather than multinational, international, some things are of a scale that it's better to do on a local, subnational level. So for those type of things, I think that would be a better direction for them.
Yeah. And I don't know if it was kind of directed to me, but one thing that really stuck out for me is what you said about training and education. And I think that's the case even in the medical technology space in general. I'm not so sure it's actually that important for pharmaceutical companies, but medical technology companies absolutely. And we're not talking medical technology, we're talking advanced medical technology companies where literally the speed of innovation is so quick, you know, it's unsafe. It's unethical if you don't do training, and no one charges for that training, and due to ethical and other considerations within medicine. And so, as Medtronic, I founded something called the PPP Council, and my colleague Hope Taft is here. Justin, I think, is on the line. Shireen Yassin. We have a whole team. We have 40 people at Medtronic, all functions, all of us, and you know them well, Mark, that are focused on a global basis. We're a 90,000 employee company, all focused on PPPs, different types of PPPs. We have all functions in. FDA would be happy to know. The head of regulatory affairs, the deputy head of regulatory affairs is in there. The head of global finance is in there. Everybody that has any piece on the PPP piece is in that council. It's a whole family effort. It's a very holistic effort. And it actually was the inspiration of Joe and Clarion's work, frankly, that brought us there.
Yeah, if I can just interrupt you
Yeah.
there. I think that's an important, if I can draw the learning point out of that, especially for people who haven't worked in private industry, is from the private sector side, it costs a lot of money to do this, and you're in competition. So, regularly I would have, when I was at Philips, I'd have to go to the senior management and say, I'm going to blow $1 million on this, and you may see it, not a dime back on it. So, you have to commit substantial resources, and I think people in the public sector don't always appreciate the risks that are being taken from the private sector for potentially no reward at all.
Right, including your job.
Yeah.
Let's be honest, okay? So listen, everyone, thanks very much for joining us this morning. Thank you, Mark.